My name is Lauren Fouts. I'm the Director of Corporate Operations here at Bloom. We're excited that you're here today for our webinar entitled The Future of Medicare Advantage Leveraging AI for Financial Growth. Just a little bit about Bloom Value. We are an AI enterprise platform company offering a wide array of products and solutions for healthcare organizations. Bloom brings together seasoned AI pioneers as well as experts in healthcare management and delivery to create solutions and services that allow businesses to run profitably and to deliver the highest quality of healthcare. Through machine learning and artificial and augmented intelligence, our clients gain unprecedented visibility into their products or into their verticals, while also reducing costs and driving revenue. Our AI solutions serve hospitals and health systems, as well as health plans, Medicare Advantage, and other risk-bearing organizations. You can find more about us at bloomvalue.com and connect with us there. Today's webinar is on the financial opportunities available through leveraging AI, enterprise AI specifically. We brought together experts. Bloom CEO and founder Arun Hampapour is an AI expert, and Jared Turley is the CFO of Novana Physicians. We'll have a conversation today focused on a few questions, but we would love audience participation. So if you have questions, we'd love to incorporate those into the conversation. Feel free to put those into the QA. We'll be monitoring that. And with that, I'll turn it over to Arun.
Hey, thank you so much, Lauren, and to all of the people attending. We appreciate your time. Thank you for joining. And we want to really keep this conversational, but with Lauren's help and Jared's participation, we've put together some questions that can drive the conversation. So my name is Arun. I'm one of the co-founders of Bloom and a data guy by profession, if you will. Before founding Bloom, I was with IBM's research division and other divisions where we use data to help our clients. So I've done enterprise AI projects in retail, in travel transportation, in cities, in homeland security, you name it. So I've had the privilege of understanding how to apply enterprise AI, and we're bringing that to healthcare and specifically to Medicare Advantage, which continues to be challenged along many different dimensions. And Jared, who brings the financial side of this, will really make this conversation very interesting. Jared, please do introduce yourself.
Yeah, thank you, Arun, and thank you, Lauren. So my name is Jared Turley, and for over a decade, I've been working in Medicare Advantage in the state of California. We currently run 5 different IPAs with over 100,000 lives throughout, and we break that out with Medicaid, Medicare Advantage, commercial. We also have ACO organizations. So we've been doing this for a long time, but we have identified struggling IPAs and provided turnaround plans. We've done both partial risk and full risk, so institutional and professional. And yeah, very happy to be here. Thank you, Arun.
Excellent, Jared. So I wanted to kick this off by asking you, what do you think are the top 5 challenges for a Medicare Advantage organization?
Yeah, I appreciate the question beforehand, but it doesn't take much to identify some of these challenges. The number one challenge I think that we face when we're running an IPA or a full or partial risk entity is, what data are you being given by your health plan partners, and how can you utilize that data within your organization? I love the graphic that was provided because it really shows a lot of the areas where either revenue is being lost or there's leakage through expenses. When we're trying to identify the data, if you're a smaller organization with only a single payer, Humana, for example, or HealthNet, if you have one single format coming with eligibility and revenue files, and you have one set of data to work with, but with 5 different IPAs, we have 14 to 15 different payers that we're working with, all with different file formats, and trying to tie all of those together and then streamline that throughout the organization to provide good data so that we know where there might be gaps that we are missing is a very difficult process and probably the number one challenge that we face. I think the second would probably be capturing HCCs because, as everybody knows, an amputee that has lost a limb is not going to grow that back in the next year. And so if you want to be able to capture the revenue for being able to provide that care, because as an organization, you're required to still provide that high level of care. So your costs are going to be maintaining that same level. But if you're not capturing those HCCs year over year, you're not going to get the revenue. And it's going to be lowering your or increasing your MLR, which is very difficult for an organization. So capturing those HCC codes year over year across all of your providers and all the different patients is very difficult.
Jared,
So
as
streamline.
you
Yeah,
speak
go ahead, Arun.
these challenges, it appears like most of the day you're just trying to gather data and put it all together.
Yeah, it's actually pretty surprising how much data is actually within a small organization. We're talking 100,000 patients, and within Medicare Advantage, there's millions and millions of people, and so there is a huge amount of data at your fingertips. But being able to utilize it, like I said, is a very difficult process. And most of these smaller IPAs have homegrown solutions, some of which are just to be blatant, entirely inadequate. The third, I think, in bringing that up is streamlining the 5-star capture process. This has been a huge driver in recent years in working with our health plan partners in streamlining that 5-star process. We have a great example where we had a mammography bus that showed up because we were trying to capture that 5-star measure. And the question was asked, what else did we capture in that moment? And the staff said, well, we're here for mammograms. And so it was such a missed opportunity that it was quite frustrating to know that, look, you had a patient and a provider in the same room together. Why are we not capturing all the 5-star measures that we can? Because we're just essentially going to have to call that patient back and try and get them into another visit. And patient compliance is a very difficult thing that we face and deal with on a day-to-day basis.
Yeah, indeed. And this typically goes to that siloed operations bit, Jared, when you do have different processes which have to be dealt with by different departments, but somehow we don't connect the dots, so to speak.
Yeah, and what you don't have in this graphic are all the lines that go from each department for where all the data is transferred. It's an incredible amount of data and an incredible amount of work that has to be done between departments in order to make that really work. So when you're looking at the utilization for number 4, really identifying all the things that need to happen within a department, whether you're dealing with patient preference, whether you're dealing with the costs between 2 different organizations, whether that be SNF or otherwise, trying to direct that patient care in a financially mindful way, but also being mindful of the quality of the patient care is a difficult thing to deal with on a day-to-day basis. And that really ties in with the final one for managing the physician network. We have, at least in our experience, a lot of aging physicians, and you're trying to maintain that network adequacy. You're trying to maintain that continuity of patient care. And when you're trying to do all of this together, and on top of that, you have this network management piece that you've got to deal with. It's an incredible challenge, for sure.
I can appreciate.
So what I want to do is push this back to Arun, is because having dealt with these challenges, like I said, for over a decade, we're really looking for something different. And I think healthcare as a whole is ready to adopt some AI, but the question is going to be the underlying question is going to be, how is it that AI is going to be brought into these processes? But to start, how do you think, Arun, that AI can help with the challenges that I listed out?
Thanks, Jared. Lauren, if you go off to the next chart. So I often say, well, why really are you interested in AI, Jared? I suppose you really only care about the business result. AI is a means to an end, and often the word AI conjures up pictures of ChatGPT doing stuff for you, but there's a lot more to it than that. So the way I've thought about AI in the Bloom context is, well, what is your question? So you said HCC gaps was on your list of top 5. So how do you find HCC gaps? And out of the 15, 20, 30,000 members that you may have in your under your management, which ones need chart review and which ones don't? So these are really questions that drive both efficiency and value. So what AI can do is, find the needle in the haystack. I'll keep coming back to this quote. So out of the 30,000 members that you may have, well, you may only need to review charts and risk adjust 5,000 of those. Which 5 of the 30,000 is the question? And what AI can do is really go through all of the charts for all of the conditions and just pick out the 5,000 and tee it up for the risk scorer, saying, hey, here are the 5,000 that you need to really go look at the charts for. And here's specifically the conditions that you need to go look for. And it's already gone and done all of that work for you. So typically, AI is really giving you visibility. It's finding those exceptions and positioning it for the risk coder for proactive optimization. And the same model really applies to or the claims, or almost any other part of running a Medicare organization, if you will, Jared.
Yeah. So in thinking about, all of the different silos that we had on that first graphic, each one of those, Arun, is going to have either a homegrown solution or it's going to have some different software that they're dealing with. There's the EMR system, there's claims, there's the system, there's different software. It's a Franken network of different softwares. So when we're talking about AI, are we talking about a replacement of softwares?
No, not at all, Jared. Typically, the way AI systems are built, sometimes you could build them right into your transaction system. But in many cases, what we do is we bolt it on. So you possibly already have a claims management systems. In some cases, you may already have a quality software. But what we do is bring in our solutions as a platform that attaches on top of that, consumes data from there, and can actually send actions back directly into your existing platform. So it's not a rip and replace. It's really a bolt-on type activity.
Interesting. So one of the things you hit on earlier was this risk adjustment piece in talking about AI. So can you talk a little bit more about how your solution works with capturing HCCs or how that risk adjustment module is working?
Indeed. So what you see here on the screen is, as Jared, is risk adjustment is a complex process, and it actually runs in many cases over months and years, right? All of last year's risk adjustment, I think people are scrambling to get it all ready. So by the end of January, they can turn it in. Then there's these deadlines in July, and what you submit in January may turn into revenue in July, or it may take a little longer, right, by the time it goes through. So we have multiple tools that are outlined here, from looking at how the transition from V24 to V28 is going to affect your business. By the way, V28 is not the end. There's a V30 coming, I hear. So that's a continuous process. Or it could be around making sure that the HCC codes you submitted in January actually turn into improved RAF in July, because that's not always a given. Because we've seen cases where we turned in the right numbers, but the health plan, in somewhere along their process, it just didn't make it all the way through to CMS, so the RAF score didn't change, right? So you can apply data analytics, AI in all of these places, but I'm going to dive into what's called the risk coding app here, which gets to the heart of the matter of looking through an EMR record to find specific conditions that can be coded up as an HCC code. And if you go off to the next chart, Lauren. So what you're seeing here is an actual medical record. It's a part of it. And in this case, it comes into our system as a PDF. And here, the model that we've run is looking for morbid obesity. Right? Just to make a simple example here. So what the machine has done is it's gone in, opened up the PDF, read through it, and it actually marks this little yellow box on the left here, where it's highlighting that BMI is 36.95. So that's a requirement for morbid obesity. So that's what the machine does. So without the machine, then a coder has to open the chart, double click the PDF, go read through it, find the place where it says morbid obesity, where it says BMI, and then they have to go spot the other condition, which is like hypertension. These two together make morbid obesity, but it turns out that there are 4,000 other ICD codes that are possible to be able to call trigger morbid obesity for this particular patient. And you can imagine, I have a much deeper appreciation for what coders do because I don't know that I could actually remember in my head 4,000 different codes and conditions and symptoms that could trigger morbid obesity. So the fact that we can make the machine do that, I think is going to be a huge value to MA organizations.
Yeah, and this is actually pretty interesting. One of our processes when we go into any new IPA that we're doing a turnaround plan for, one of the first questions we ask is we go to the quality team and we start start pulling in charts. What are the missing HCCs? But you're pulling every chart and looking at every single one to see which one might be missing those HCC gaps, and it can be a very inefficient process, but a worthwhile process in the end, because again, this is looking for different revenue gaps or leakage that may have happened. So how is this making it more efficient in your mind? Can you explain that a little bit?
Yeah. So if you go off to the dashboard, Lauren, so this is really what how an end user, a risk coder, potentially would use this AI tool. So when they come in, so to speak, in the morning, and the risk coder has been assigned provider one here in this box called members, without AI, they have 55 different member charts that they need to go through and find all of the members where there's a potential RAF gap, which is also called delta RAF. So without AI, the coder has to go through 55 charts. With AI, it's pointing out that there are only 3 charts which actually have morbid obesity conditions buried in them, right? So with the AI, they just click on that bar with 3 on it, and it just tells you, okay, here are the 3 members who potentially have morbid obesity. So the coder is now just doing a verification. They click on the PDF, it scrolls up and shows you where exactly is the BMI, where's the hypertension, or where's the atherosclerosis, or where's one of those 4,000 other conditions that we talked about. So what's happening here, Jared, as you can see, is 3 out of 55. That's less than 10% of what of work. So 90% of it has just been taken off the plate because it's not necessary. In many cases, it's busy work. Again, so we've already spotted the needles in the haystack.
Wow, yeah, and I can imagine that, a lot of the things we look at is, these coders are not just tasked with finding missing HCCs, but things that are overcoded, and making sure that it's just a chart audit, really, to look at, are things coded to the highest level of specificity based off of the notes and everything that's in the entire chart, not just a provider chart, and were things overcoded potentially that might have been missed. And that's a significant risk and something CMS has been cracking down on a lot, as we see in the news recently with some of the health plans.
Indeed.
Super interesting. So Arun, when we're talking about the business impact on an enterprise, what do you see is the business impact of enterprise AI on a Medicare Advantage institution or organization?
Well, Jared, so if the way we looked at it is at potential areas of opportunity, and as we had a discussion, you'd pointed out that, well, there's both a revenue upside by applying AI and uh, cost reduction that goes into this. And I think the model that you built out is a great one. I'll pop it back to you for us to walk through that model of where are the opportunities for applying AI.
Yeah. So and I appreciate getting this ahead of time. When we're looking, and this is in the state of California, and just some caveats to this is that we're just looking at 10,000 members for an organization. You have the institutional and professional side. There are a lot of variables when you're looking at an entire organization. You're looking at different contracts, contracted rates, different DOFers, so that's going to affect your claims expense. And there's so many variables in this, but when we're looking at our 5 different IPAs that we're currently working with, and we're just taking an average, you look at 10,000 members, and your institutional and professional revenue is about $130 million, assuming that you're at a 1.0 RAF or just slightly higher than a 1.0 RAF. And CMS, according to them, you need to have about an 80% MLR. So 80% of your revenue needs to be spent on your cost of medical services. So that leaves you $110 million roughly. And so there's not much overhead, and you can be more efficient with your claims expenses. And that again depends on what's in your contracts, and you can absolutely be less efficient. And that's typically where we have seen things recently with some of these IPAs that we're looking at and providing turnaround plans for, is that their claims leakage is very heavy. And so when we're looking and going in and providing these turnaround plans, you can see some significant margin improvement at the cost of a high amount of labor, hiring coders, hiring claims examiners, all the above, to try and both help with the increase in revenue and the decrease in your medical claims expenses. And really, if you just have the one revenue piece, that can fix a lot of things. But to make an efficient IPA, it's a lot of heavy lifting involved. And I think the next one that I provided earlier is a little bit more detailed. When we're looking at our claims adjudication process, you can have some significant cost savings when it comes to just going back into your claims adjudication and fixing the process. Utilization management, you can save almost 1%. Authorization adjudication costs, the medical cost optimization, you can save a significant amount by going in and fixing some of the issues that you might see and that leakage that we kind of presented on that first graphic. It's organizational efficiencies, but again, it's a heavy lift to do a turnaround plan like that. But the risk adjustment piece is one of the things that provides one of the highest amount of dollars by itself, and is a significant opportunity wherever you go, I think, in today's IPAs and then the way that things are working right now. But I mean, the graphic, I think, speaks for itself. You can provide a significant amount of both savings and revenue opportunities. But what we're talking about today is how is AI going to, like you said, have that bolt-on solution to drive this.
So
I think that begs the question, Arun, is, we're not talking about people replacement, right? Because we have to have physicians that are doing the codes. You have to have coders to review this. You can't just, I mean, you can have it running on an ongoing basis, but you have to have people involved, which people can be imperfect. But can you speak a little bit to that?
Yeah, indeed. So, Jared, before we dive into that for a minute, if you're go back one slide, Lauren. When you look at these different processes, do you have a perspective on which of these may be most suited for some kind of automation? Like which would be, like, say, what's the low-hanging fruit is my question, right? Among all of these things, if you had to start from your perspective.
I mean, one of the low-hanging fruit and the ones that we focus on a lot because it does drive the revenue is what you showed before on that patient chart is fascinating because when we're presenting, a provider and we're working with that provider to say, hey, we need to look at all of your records. We'll get the coders in there and they're going to pull every single patient chart within that provider's medical practice. And that is very labor intensive. It doesn't look efficient, and it's not. But it's what you have to do in order to make sure that things aren't overcoded and that you are coding to the highest level of specificity. So that's one of the low-hanging fruit that I would identify based off of what we're talking about today.
Indeed, that's very interesting, Jared. And all of these processes have different levels of complexity. So as we look at technologies, that it has different implementation times, if you will.
Very interesting. So how do the Bloom solutions support these MA organizations in your mind, Arun?
Yeah.
What in your experience, because you've been doing this for a number of years and you've done it for many other much larger organizations. Some of these are a bit smaller, and we're not, talking about the health plan, piece yet. But can you speak to that a little bit?
Indeed, Jared. So the way we think about um, AI or technology is that it's really a closed loop optimization solution. At the end of the day, for somebody like you who runs a business, technology is just a means to an end. You really want better patient care at lower cost. But how do you get there is the question. And often it's kind of there are 4 or 5 tiers to this journey. And Jared, if in many cases, maybe I'll put you on the spot. If I ask you a question about your members, or saying like, hey, which of your providers is dealing with the most oncology patients, or there are many questions of that sort, I bet you would not have an answer off the top of your head, and you may not even have a tool where you can go look. You may have to then shoot off an email to somebody and ask the question. Is that accurate?
Oh, that's a fair statement. When you're asking a lot of your IT department, especially with the homegrown solutions, to pull the data, and you have to be able to have that clean data, which it goes back to all those files that the health plans are sending you, because our health plan partners give us so much data, but unpacking that in an efficient way is quite a task.
And that's indeed, in many cases, that's how we've built our solutions, which is getting visibility so that you know what's going on is the starting point. So that you look at glass box visibility on the left, that's where you typically start. But all the way on the right is proactive optimization, which is really where things fit into an actual action. At the end of the day, either you want to authorize this particular prior auth request, or you want to deny it or redirect it. That is the action. So under proactive optimization, that fits into item number 2, which is the intelligent authorization engine. So that's an engine which we've built, which can take authorization data that comes in and process it through multiple layers of decisions, like eligibility, benefits, coverage, contract carve-out, and finally medical necessity. So the machine can actually do all of this, and it just tees it up for the human to say, hey, I think this authorization should be approved. And so the human can simply say yes. And in many cases, you can really do that at bulk. So when there's 1,000 authorizations sitting in the queue, the machine simply says, here are the 600 that you can approve with one click. And that really is how we build efficiency into your process. And it's not always only about efficiency. There's the flip side of it, which is quality. So if you don't have to look at 1,000 authorizations today, and you can just focus on the 400 that have some kind of complexity built into them, then you're doing a much better job on the 400, right? Because you're not sorting through the hay, so to speak. You're just focusing on the needles, which is the common theme here. Jared, any thoughts on this?
I think AI is incredibly exciting, especially in healthcare, because, like I said, we have a lot of homegrown solutions that we've been using for and building on for 30 plus years, in our case, and it's difficult to be efficient, and a lot of those solutions are efficient, but when you're talking about taking those into another organization or to do some type of turnaround plan, it can be quite difficult when you're taking old legacy systems and trying to make those efficient, where you might have something that can be a better tool, but it might not be able to go across systems. And looking at my financial brain, and you have cost benchmarking here in front of us. I'm interested to hear what you have to say about the cost benchmarking tool that you have there at Bloom.
So the word benchmarking basically is saying, well, how do I compare? Right? So basically, if you're running your professional claims are adding up to $250 PMPM, is that good or bad is the question. And if you have like 50 different PCP groups that are looking at your 30,000 members, which one of them is costing you more or less is the question. So what we're able to do is establish an internal benchmark, say the average PMPM across your entire 30,000 population, and then use that to sort PCP groups into performing good versus performing less than expectation. And well, that's always not a simple comparison, as you know, Jared, because the complexity of patients, the acuity of patients varies. So if a medical group has just 2 or 3 oncology patients, their costs could be completely off the charts. So we're able to then control for those types of variances and remove those patients from the benchmark and so on and so forth. All of that done interactively in a tool set. So hopefully that kind of gives you a clear picture of where to focus.
Oh, and that's incredibly exciting. So in thinking about, AI, so separating AI for a second and looking at what our organization is as it exists today, when you're talking about the labor force or the team members, adopting some of these new tools is not very foreign to them. But when you're talking about providers, on the other hand, or changing any of their processes, it can be a very difficult task. And that's one of the concerns with AI is how's it going to change the process, especially for the providers. So if we're talking about bringing on AI solutions, Arun, how do you suggest an organization like ours, or even a larger organization, go about it?
This is a great question, Jared. I would answer it at 2 levels. One is you really need leadership to buy into the idea that something like this can have a transformational effect. What I'm going to do is, before we talk about the physician process, I'm just going to go back to authorization and authorization approvals. So today, in your organization and maybe in others, you have a team, there's a director, and they have possibly 10, 15, 20 staff members. And as authorizations are flowing in, they're possibly clicking on each one of them, applying some kind of a set of rules and then saying yes or no. And then some of them they may send to the medical director for additional adjudication. Once you bring AI into the picture, you really need what I'm going to call a bulk approver role. Right? Because what AI can do is it can take the 1,000 authorizations and group it into the 600 that really don't need any scrutiny because they comply very well with your business process and your business rules. But now you have to put the power of approving 600 authorization into one person's hand. So you really need somebody who can look at this somewhat from a statistical perspective, or because you want to be able to do some quick queries and say, out of the 600, which ones are a specific kind, which ones are pain management, do they meet the criteria, so on and so forth. So you really change the role. It's no longer somebody who clicks on every single authorization, but there's one person who can look at the big picture and have the ability to go and hit yes and approve 600 in one shot. If that makes sense.
Yeah, absolutely. And in thinking of a recent example of an IPA and health plan that we were looking at to purchase in the state of California, when we were going back and looking at what visibility, and I love that word that you have up there, is what visibility did the finance have in how the operations were performing? Because we knew that it was not performing very well, but where it was not performing, it was just a guess. And in that case, you had a whole line of business that they thought was losing money, and they decided that that was going to be the one that they were going to terminate. And when we were able to finally get past all of the noise and get into the actual data, that was a profitable line of business for them. So that visibility can really impact business decisions. And that's one of the exciting things that I look at, is from a financial perspective, at least, being able to have all the high level views that I need, but being able to drill down to the details, I think is going to be one of the most valuable things that AI could provide.
And Jared, as you kind of outline that scenario, something comes to mind. One of the things we realized as we built these out is there isn't a perfect tool that I can craft for you without having you involved in the loop, especially when it comes to things like visibility, right? So part of what we've done is to do what I'll call an 80-20. So when we give you a visibility solution, we know that based on the use case, if you're trying to do an acquisition, you may have different questions. Whereas if you're trying to do some day-to-day cost-related matters, right? So what we offer up is this idea of a service where we start you off with our out-of-the-box visibility solution, but then we're able to kind of customize it and iterate with you in the loop, where you say, hey, I'm interested in this question, or I want to join this additional data source, so on and so forth. So we can actually attune it to your needs. And at the end of the day, you're really interested in answering the question and finding that specific line of business that is profitable, although it may not appear so at the beginning. So we brand that as Ask Bloom. So you can actually keep, it's not just a product that you buy, it's a service which enables you to answer questions, but it's really using your data, and it starts off with our base solution.
Very, very interesting. So when we're talking about an implementation, if I were to just say, hey, I'm just going to pick one or two of the modules, or just do an enterprise, what are the timelines that you're talking about when doing implementations?
It's a great question, Jared. We typically we have a promise which we call 6 weeks to value that you'll see on our website, and we hold that somewhat sacred because we know that when you get into one of these projects, being able to quickly get to at least a part of the answer is important. It may take a while to get everything implemented and all of the T's crossed and I's dotted, so to speak. We typically, and in most cases, clients want the visibility solution. So within 6 weeks of having data and data connections set up, you will basically get the base visibility solutions for any of these processes. And depending on the level of integration we need to do with your base system, within a 4-month period or 24 weeks, you should have the optimization engine running as part of your organization.
Very good. Well, Arun, I think is a great presentation. I don't have any further questions. I think it was fascinating to look at all of it, and very exciting to see that these capabilities are now like within our fingertips, just within grasp, to be able to start implementing AI within our organizations. I'm very excited for the efficiency.
Thanks, Jared, and thanks for being part of this. And Lauren, did you see any questions?
There were 2 questions, and Jared actually asked one about implementation, how long it takes. One is a little bit similar. I see lots of things that my organization could use, but if I'm not ready to commit to the full enterprise solution, where do you suggest starting?
Yes, a great question, Lauren. And typically, as I said, I'd recommend starting with the visibility bits, because that really will lay out the map for where the organization needs to focus and where are their opportunities, so on and so forth. So in most cases, that would be our recommendation. But often we have a discussion and we do an assessment And in this case, we're offering that up free for participants of the webinar, where they could give us some basic data, participate in a call, and we're able to come back and say, hey, here's really where your opportunities are. Here's how much money you're leaving on the table. Here's your opportunity from a cost perspective. So that can well be a guide to how to start this process.
Thank you, Arun, and thank you for all of the attendees for joining today. If you have any other questions, feel free to put them in the chat or the QA, and we'll get back to you. As well as if you'd like to reach out to us and continue the conversation, you can reach out to Amanda Light. Her email address is listed there, amanda.l@bloomvalue.com. And we would love to chat more about our offerings and how AI can help your organizations. Thank you.
Hey, thank you, Jared. Thank you, Lauren, for hosting this for us.
Thank you.